Hello there, my name's Clates. I hope you're all having a great day, those of you watching this, and this is the first video that I'm going to make, or record I'm going to make, of the dental treatment I'm about to go through. Now if you're watching this for the first time, obviously what I'm talking about is all these front teeth here having to come out, and what they're going to do is put posts in. That's the end result. And with the posts, obviously different kind of fitting teeth, but that's how it's going to be done, posts. Now I don't know if anyone here has ever had posts, or you know anything about posts, but it's quite a process. I mean, they have to cut the gums, they have to split the bone a bit, they have to put something in, etc. So it's quite a process. So this is the very first video to do with the record of my converting my teeth to posts, as it were. So before I start, I would just want to say to you that I've had a long time where I've had trouble with my teeth, and anyone who's had trouble with their teeth, they know exactly what I mean. Besides pain, besides discomfort, because they bridges, they fall out in the most awkward times, like you're busy having a meal, or you're talking away to your friends, say, hey, how's it going, buddy? And the next thing, teeth drop out, and you know, and of course you don't want to everyone you meet. So yeah, very disconcerting and uncomfortable. However, what I did find in the end, it's probably about a year ago at this point, the very first time I ever discovered it was a substance called this. I don't know if you can see it. Very nice substance it is. It's actually called X200 Rely and dual cured composite resin adhesive luting cement. Fantastic stuff. Now the first time I used it was with just one post, a small tooth. I'm going to try and show you. If you don't mind looking in people's mouths and that disgusts you, then you may want to look away. If it kind of interests you, then it's something you might want to look at now. So this is what it looks like. So can you see it? Yeah? Yeah? Yeah. So one post came out. Now I used this stuff on it. Fantastic. I never had problems with it, at least a year on. The problem I did have, right, was I didn't realize that it would work so well on the top. So when it came to the top teeth, I tried all sorts of other things, thinking that they were better than this, because this was just the one post. I mean, I spent up to nearly 54 quid for something similar. Within less than a month, it dropped out. Same thing, you know, your teeth are missing, etc. I finally, out of desperation, did try this stuff upstairs, thinking, oh, it's not going to work upstairs, it's going to be just the same. Wow, what a surprise. It works fantastic. And if only I had realized that months ago, I wouldn't be in the problem I am now. So this is the company that provides it. I don't know if you can see that nicely or not. Just going to move my light there a bit out the way so it doesn't reflect. There it is. Yeah, it's called Dental A to Z, or Z, depending on what part of the world you come from. Dental supplies. Now these are really good guys, really nice guys. Besides not charging exorbitant prices for their substances, their chemicals, they're very quick to respond whenever you ask a question. They're also very quick to send their stuff. I mean, I've never waited more than about 3 days, which is amazing. Or some of them you have to wait as long as 35 days before you get it, and then it doesn't work anyway. So what a waste of money and time that is. So these guys, brilliant, and I highly recommend them if you find yourself in a situation where you need just one post or a bridge to be sorted. This is the people to go to. They will help. Okay, so that out the way. Now they're not paying me any money, by the way. I'm not getting any sponsorship from them or anything like that. I just genuinely believe they're a good company and they're good people, and it's worthwhile mentioning it to people. So I'm going back to what we were saying in the first place, why I'm here. So this is the day before I actually start my treatment, day before. I'm having my teeth sorted. So I wanted to start right at the beginning, as best as I could right at the beginning. So this is the day before. Tomorrow I'll have the treatment. Now I would like to, if it's possible, excuse me, I would like to, if it's possible, video the actual process. However, I'm not sure I'm going to be able to do that. There's hygiene rules and regulations in the dental surgery. Whether they'll actually let me video any of those, I don't know. But having said that, what I will try to do my best is you can have a look at what it looks like today, the whole process, and then tomorrow when it's all done and dusted, hopefully I'll be able to video, depending on whether I'm up to it or not, but the whole process. Then I'll video what it looks like, which won't be a pretty sight, I'm sure, but also I'll tell you a bit about how it felt, the pain that I had to go through, if there was any pain, and how it felt for me. And I probably will sound really weird. I probably sound something like, but you'll have to do your best to understand me, I'm sure. Anyway, so after the treatment, then I'll give you the second video. So this is video number 1 of the record of the dental treatment I'm about to go through, and then hopefully after the treatment tomorrow you'll get the next video, second video, and then it'll probably be about a couple of weeks, three weeks maybe, before I'm able to go to the next stage. I don't know what the next stage is. All I know is that they're taking all the teeth that I have left, they're taking them out. There's only 3 to be honest with you. They're taking them out, and then I get given a set of false teeth. Now how that's going to work, how that's going to fit, I have no idea. But that's going to last for, I think you said 2 weeks or 3 weeks, and then I have to go back, and that's then for adjustments. I don't know if they're cut stuff or stick stuff, or I don't know what they're going to do, but that's the third one will be then to adjust it. Thereafter another 3 months, when they then do the next process, which is obviously cutting your gums, and I think they have to split the bone. I don't know how that's going to work. Split the bone slightly to put the posts in. So I mean, my dentist is pretty worried about doing the treatment, to be honest with you. You should hear how he talks. So that doesn't exactly inspire a huge amount of confidence in me either. But having said that, it's something I have to go through. I've started it up, so I need to do it. So, and obviously there's nothing I can do about it. Now, you can't see where you are. Okay, you can only see the little piece about me, but I'm actually a paralyzed person. Half of me is paralyzed. My right hand side, my right arm, my right leg, and the right side of my face is numb. It literally feels like I'm at the dentist anyway, and it's just starting to wear off. You know that sensation when it's just starting to wear off? That's how it feels on my right hand side of my face and my mouth. That's one of the reasons why I need to get posts, because you can't feel it properly. It means that the teeth, or the false teeth, I won't know if it's settling in properly or it's sitting properly, and if I go to speak or go to bite, I won't know if I'm actually doing some damage or not. So that's one of the things I need to look at. So well, thank you very much for listening and taking time to see what's going on. Hopefully it's all going to work out. Hopefully the advice I gave you about that substance is going to be useful to someone, and we'll do our next process now. So this is the very first video, the day before the treatment I start, getting these new posts. So yeah, next time you see the smile, it might be better, who knows. So thank you very much for listening. Speak to you later. Bye.